So what exercises do I prescribe for the SaeboFlex? So my exercises focus on grasp and release and the repetition of finger extension. I designed the exercise so the only difficult component is the release or the finger extension. As this becomes easier, I work in more components. So they have 10 Saebo balls, so I ask them to go through each exercise 10 times of either 2 to 3 sets, aiming for 250 to 300 repetitions per 1 hour session. So in this first video, the exercise is focusing only on the grasp and the release. So this gentleman is around 7 months post-stroke and only just learning how to activate his finger flexors. This movement is so difficult, I'm needing to provide some assistance with the positioning of his arm and hand so he can focus on just the flexion of his fingers for grasp. You can note he's also on the lightest spring resistance. Initially, when he first tried to complete this exercise, he couldn't flex his fingers for grasp without activating all his flexor muscles, which meant his hand would move further away from the ball the more he tried. For the first few weeks, this was all his exercise program consisted of. And at home, he would guide his hand with his left, because this was an outpatient. In for the ball, good, squeeze in, squeeze, squeeze, good, now lift, lift, good, and relax. Good. So this next video is taken several months later. And you can see the improvements he has made. Yeah, you can see the improvements he has made with his shoulder activation and control, the speed and the efficiency of his grasp. So this exercise has been designed to improve his proximal strength as he has to flex his elbow to release the ball to the target, as well as the control of the release. So he has to control the release of the ball and the position of an arm so it lands in the cone. And this recovery has allowed him to use his arm as an active assist throughout the day. So as the release time becomes easier, that's when I start to grade the exercises to include proximal shoulder movement or teach the patient to isolate muscle contractions. An example of this is the setting up of this exercise as in the picture shown. So it teaches the patient to grasp and release the ball while activating their shoulder flexors, which is often a difficult component for our patients. So this is another exercise where the patient has to maintain their grasp while sidestepping to release the ball. Good, keep squeezing. After the 50-minute session with the SaeboFlex, it then gets removed, and the aim is to complete about 10 minutes, attempting grasp and release of a small ball without the device. The finger flexors tend to be a bit more relaxed once the SaeboFlex is removed, and hopefully the finger extensors are more activated after the session. And this is where you start to see some of the changes when they can demonstrate some active finger extension and release the small item. So what outcome measures do I use? So generally I will use the box and block test or the MMT, and I find them most useful for capturing either the improvement in muscle activation or the increase in active movement and speed with their grasp and release. I also tend to do some videos as well, and the videos are a good way to show the patient how far they have come with their overall arm movements.